Good evening. My name is Misty. I'm from the respiratory department, and I came to talk to you about your COPD. I know you've had a recent COPD exacerbation, and you're just kind of feeling like you don't know what to do. Your nurses said that you were just not really understanding your prognosis. So I want to go over everything with you if that's okay. I have a few handouts, I have some information. It's a lot. So if you have questions, just stop me and we'll talk about it. That way you have a clear understanding. I'd also like to follow up with you in about like a week and a half, if it's okay if I call you at home. That way, if you have any questions later, we can talk about those as well. How does that sound? Great. All right, so first off, I'd like to talk to you about smoking cessation. I know you've been smoking for a long time. You've been smoking for like 30 years. That's a long time. And 2 packs a day, that's a lot. And I understand that's going to be really, really hard for you to quit. I was looking back at your paperwork and it looks like you've quit before, which is great. That means you can do it. And I have so much faith that you can do it again. But we need to get you to stop. That's our main goal now. And I'm going to give you some goals because it's important that you have certain goals that you can meet. So I'd like to talk about in maybe the next 60 days that you've quit completely. Okay, I know that's a big goal, but we're gonna do that. Okay, I have faith in us, and we're gonna make it happen. Okay. So what I don't want to put you on any medication for that because I know you've quit in the past, and I see that you also have a history of depression. So I don't want to counteract anything with that. If in the next 30 days you're still having a lot of difficulty, we'll talk about nicotine replacement therapy. Have you ever done that or heard about that before? Yeah, so that's the patches. Yeah, people do patches, they do lozenges, stuff like that. And I think it's really important that we don't do that at first, but if it needs to happen, it's an option and we can gladly come back to it. There's actually a study done, and I like to quote studies that way that you understand that things have been looked at and seen and rationalized. There's a study by the European Respiratory Review by Philip T. It was done in 2018, and it says that smoking cessation is the most effective way to stop the progression of COPD. Now, I understand that you've had two COPD exacerbations and hospitalizations within the past 3 months. So maybe if we quit smoking, we can cut those down. I think that if you quit smoking, we can definitely cut those down. That would be great. Um, because of nicotine replacement therapy is so iffy. Also, this review talks about how, with depression, you should watch what kind of medications you give. And there are medications that can help you quit smoking, but because of your depression, I don't want to mix them. Okay? I just want you to try on your own and then we'll try the nicotine replacement therapy. I think that's our best route to go. So the next thing I want to talk to you about is pulmonary rehab. Okay, this is a goal that I want to set for you, a 12-week program. It's great. I understand that you don't have a lot of help at home. You live by yourself, is that correct? All right, okay. So I think this would be great for you because it gives you goals, all right? It gives you somewhere to be every week, okay? And you'll go in, you'll be with the same group of people. Normally, they have the same prognosis as you, diagnosis as well. So they're in the same stage. So you're in stage COPD, and they are as well. So usually they'll group you together. You might have a few oddballs in there, but normally they would group you together. And this will give you, they can go over ways to help with your endurance and things like that. There was another study done by a study of exercise counseling. It was done by Hops, Ten Hacken, Van Hagelen, and D. Grief in 2009. And it showed in a 12-week pedometer-based exercise counseling that number of steps per day per patient were increased greatly, and patients' endurances were increased greatly. Okay, and those are things that we need for you. We need to increase the amount that you're walking daily, getting around your house. I know you don't want to be in a nursing home, anything like that. So we need to get you mobile. We need to get you going good, all right? And we also need to get your endurance up. so that you can do things around your house, so that you can cook and it doesn't make you short of breath and you're not leaving things on the stove or, things like that. You can clean your home, stuff like that most people take for granted, and I know it must be very difficult for you right now. So those are some things that I want to address as well. So I think that this 12-week program is a great idea. All right. We're going to see each other again in 60 days. So we can talk about that 12-week program and how it's going then. I'm going to go ahead and enroll you in it this week, and I'm going to follow up with you in a week or two, and we're going to talk on the phone. You can let me know any concerns you have, any questions, how it's going, how you don't like it, or if you do like it, and we can discuss that then, all right? But I think it's in your best interest that we start this. It's also a great social support. I can't stress that enough. You need some kind of social support, all right? The next thing that I want to talk about with you is counseling. I know that depression is a hard thing, and it's hard to understand your disease process, and it can get very upsetting when you sit there and think about it. There's a study that was done on the management of depression in COPD patients by Johan in 2008. And what it said is that patients with severe COPD are 2.5 times greater to get depression. So you are not alone. All right. This is normal. People with COPD get depressed. It's a normal thing, but we need to treat it. All right. This study also says that early management is vital, and it is. It's important that we go ahead and get in front of this so that you don't feel lost and you don't feel like you're alone. Okay. I feel like you go into counseling speaking to someone about what's going on or how your disease process is affecting you, your smoking cessation, things like that. I think it's a great opportunity for you, and I would very much like for you to take advantage of it. You know, it anxiety and depression is real, and I don't want you to think that you're alone as well. And so I think this is a great step. I would like for you to do it once a week. If that seems to be too much with your schedule, because I know we're going to get you into pulmonary rehab as well, then just call me. We're going to change it. All right. Look, we're going to do what's best for you, but I want to make sure that we're doing it. All right. We're not going to just cut it out. We're going to try it for a little while. I think that's what's best. Also, I see that some of your medications are a little wonky. Seems like you were admitted and they weren't giving you your home meds. They were, things like that. So I want to get you on Brio, okay? That's compatible with what the hospital would give you in this area. So we're going to start that daily, all right? And what that does is it's steroid type of medication to help. It's a maintenance medication, all right? You have to take it daily at the same time so that it can work. If you skip a dose, skip 2 or 3 doses, it's not effective. All right. So set a reminder on your phone. We can go over that, me and you today. And then when that reminder goes off, you're going to go take that medication. All right. I want to talk to you about your albuterol as well. Seems you've been using it awful lot, but it doesn't seem you've been using it correctly. There's this little tube called a spacer, and I'm going to get you one. And what you're going to do is you're going to put the medication inside the spacer, and then you're going to put a nice tight seal around it with your lips. You're going to push the medication down and take a slow, deep breath in. And hold. Okay? What that's going to do is it's a non-static chamber, so it makes sure that the medication doesn't stick to the inside of this tube. All right? And it's going to make sure that you get better deposition into your lungs and that medication is getting there. All right. It could also decrease the amount of times you're using it daily, because we don't want to use albuterol too much because it does increase your heart rate, things like that. It has what we call an R receptor in it. So it does do those things, unfortunately. It's a great medication, but it has to be used correctly in order to be effective. All right. So we're going to go ahead and start that as well. I want to get you in a sleep study eventually, but we'll talk about that a little later. I want these steps to come first. All right, I see that you've got some snoring and you're having a hard time sleeping at night, and I just want to talk to you about what a sleep study is. I don't want to put too much on your plate right now because you've got a lot so far, but I want to tell you what a sleep study is. What you're going to do is you're going to go into a sleep lab. They're going to hook you up with all kinds of funky little wires and stuff, but they're used to this. They do this every night, and they make it as comfortable as possible. okay? Patients do sleep when they go in there, I promise. These therapists and these nurses and so on and so forth, they do this every night, so they know how to get you to go to sleep, all right? So don't be nervous about that. But what these wires and stuff will tell us is if you're stopped breathing while you're sleeping, all right? If your airways getting cut off or anything like that. And it's a good thing for us to look at together, okay? I'd like to do that in the next 2 weeks, but let's start what we're doing first. One thing I would like for you to do is to write these goals down, okay? And I'll write them down for you. We'll put them on some sticky notes. We'll put them on your mirror in your bathroom, on your refrigerator at home, on your door when you're walking out. That way you can see these goals and they give you a good understanding of what you're doing. Okay, they're a good reminder of I'm doing this for me and I'm going to get better. And you are, and I have faith in that. If you've got any questions at all, please follow up with me. Again, my name is Misty from Respiratory Department. And I will be following up with you in the next 1 to 2 weeks, whatever's preferable to you. Also, after that, we're going to have a 60-day follow-up where we come to the office. We kind of look at everything that happened, how your smoking cessation is going, how your pulmonary rehab progress is. We'll talk about your counseling, how that seems to be going for you. And I have faith that this is all going to work out, and this is a great plan. Are you on board with this? Great. Glad to hear that. All right. Well, I'll follow up with you in the next week or two.